I'm Kathleen Hetrick. I'm a building engineer and sustainability expert bringing public health and environmental justice tools and concepts to the sustainable building movement. I work to challenge the architectural and engineering industry to address toxic supply chain issues and reduce the use of cancer-causing building materials, which impact fence-line communities, construction workers, first responders, and manufacturing workers, as well as building occupants. There's so much we can do with the built environment, and it's important to educate architects and engineers on their duty to design the built environment to address health justice, social justice, climate justice, and environmental justice issues. With the pandemic and 2020 summer protests, it feels like the building industry, and many others, are finally ready for hard conversations around equity. More and more people are interested in public health and environmental justice, and I've been able to focus more of my Project Built Environment work and conference public speaking on these issues. You'll hear more about the intersection of sustainability and urban planning in the next conversation on Reconstructing Cities.
Hello, everybody. Thank you for joining us. I'm Joanne Kenen from the Bloomberg School of Public Health, and I'm delighted to have Charles T. Brown, the founder and CEO of Equitable Cities, join us. Charles is an urban planner who, as I read his work and read about his work, and I'm the mother of an urban planner, made me think broader and differently about what urban planning is and how race and equity play into urban planning. He uses this wonderful phrase that's going to stick with me, arrested mobility. And I'm going to let him explain what that means.
Hello, Joanne. Thank you for that. Arrested mobility, I argue, is the direct manifestation of structural racism, which has unfortunately led to the intentional and deliberate over-policing of Black Americans. Through arrested mobility, I challenge you to redefine and reconceptualize policing through an aggregation of 3 Ps: public policy and planning, policing, and polity, which includes groups of self-deputizing white citizens.
I think when I was reading about it, I mean, we're all aware of what's gone on in this country for years and what we're becoming more aware of in the last couple of years. But I hadn't thought about the police interaction with a bicyclist, with a pedestrian, a jaywalker. Some of the examples you've given, what happens to a young Black man happily riding his bike who's not wearing his helmet? What is he at risk for that I am not?
Yeah, so I think it's important in the framing of arrested mobility to understand that this level of over-policing and harassment and discrimination and violence happens not only through legal, but also through illegal force. And so what happens is that through the 3 Ps that I mentioned, it restricts the physical mobility of Black pedestrians, cyclists, and other road users directly, which then arrests their social economic mobility indirectly. So it's not just to stop while riding a bicycle. This has impacts on a person's livelihood beyond that stop, whether that be imprisonment, whether that be adverse health outcomes, or detrimental outcomes as it relates to their economic and social status in the community.
So you've taken the concept of transportation, both as a practical matter, as a public, as a social determinant of health, and also as a racial justice issue or racial discrimination issue. How does urban planning, how are you beginning to correct this? What are some of the solutions?
Well, first and foremost, I correct the statement that it's a social determinant of health. I see it as a political determinant of health. And the response to that includes a rigorous examination of federal, state, and local policies, rules, and regulations through the arrested mobility lens. I think by doing so, we'll be able to point out the policies that unfortunately restrict the mobility of Black and Brown people. And again, this has impacts on them getting safely to and from work, to school, to grocery stores, to library, parks, and healthcare facilities, or simply existing in public space.
So talk about some of the work you've done, because you've worked in a number of American cities. Give us an example of something achievable.
Something achievable: increasing access to parks and open spaces. Decriminalizing jaywalking, that has been done in the state of Virginia and the city of Kansas City, Missouri. It also includes complete streets adoption and implementation, bicycle and pedestrian infrastructure investments, safe and reliable public transit accommodations, and then lastly, simply allowing people to be free in public space, which is their inalienable right.
Can you give an example of a city beside, did you work on the Virginia one, or you're aware
I
of
did
it?
not work directly on the Virginia one. I have done work extensively throughout Virginia with the Virginia Department of Health, helping to establish the Walkability Action Institute. And in that institute, we talk about the importance of transportation access and transportation equity.
So do you meet resistance, and how do you overcome it? Do people think that's just a cement issue?
My response is that without data, all you have is an opinion. So I don't argue with opinions. I only argue facts.
Okay. How about one other topic, obviously, which I believe you're interested in, is also environmental justice, which has a lot to do with cities and development of cities and who lives where and pollution and all those other issues. That's just beginning to bubble up as a national issue. Secretary Becerra has recently created a special office to deal with environmental justice and environmental decay or environmental threats and damage. If he were sitting in the audience, what would you want to tell him?
I would tell them that more resources are needed in the communities that have been impacted both historically as well as in contemporary times as it relates to environmental injustices. I'm working with the World Resources Institute on their project to electrify every school bus in America. If I was sitting before them, that's where I would start, on the electrification of school buses, because there's a deep-seated equity issue and equity implications as it relates to who is biking, who's using school buses to get to and from school. And that has, for the most part, a lot to do with your rural environment, your low-income populations, and disproportionately people of color. So electrify the school buses.
How do we think of urban planning, not as just a map or a series of buildings or a better housing complex, but as a sort of more holistic, healthy city and healthy and safe for everybody?
Well, the unfortunate reality, and this is where public health comes in, is that for far too long in transportation and health and in other sectors, we've started with risky behaviors. We've stated that your risky behaviors lead ultimately to your mortalities. That's the downstream thinking. We have to move further upstream to address the social and institutional inequities that created the disparities that we see today. And that's what arrested mobility is challenged.
We're out of time. You've given us a great deal to think about. Charles T. Brown, Equitable Cities, and now stick with us because we are going to look at transportation in Baltimore, looking at a report, Transit and Equity, Environmental Health in Baltimore. Thank you very much.
Thank you.